Hello, all. Over the past few days, the headline news have been of the imposition of travel bans and stringent penalties for Australian citizens fleeing the COVID 19 pandemic in India and wanting to come back to Australia. While there has been a public outburst of disappointment at this policy of leaving Australians stranded in India, there have also been voices raised in supporting the government policies and keeping Australia safe. To tell us more about the government side of this announcement and his feedback to the Australian Indian community, joining me today is the Minister for Immigration, Citizenship, Migrant Services, and Multicultural Affairs, Alex Hawke. Minister, thank you for joining me on Indian Link.
Yeah, thank you, Pawan.
The recent announcement of the ban and jail term of Australians in India attempting to come home has hurt the community. Earlier today at Indian Link, we got this email. The bigger worry, disgrace, and rating issue is the fine and jail for Australian citizens returning home. Is this how government supports and honors its law-abiding, tax-paying, loyal citizens? Brown skin is more contagious. This is totally unacceptable. It's not white Australia anymore. Or is it? Unable to concentrate at work. Is this what my sincere hard work gets me? Jail and fine? Minister, your reply to this?
Yeah, thanks, Pawan. Look, the government's made a pretty tough decision, and we know it's a very tough decision. All of us are aware in the course of this 1 in 100 year pandemic, nothing is normal or good. And look, India did so well in the first wave of the pandemic. They got it under control. They got their cases under control. They got their deaths under control. This second or third wave, whatever you want to call it in India, is really upsetting to all of us here in Australia, the government, to people. We regard India as our friends, a good country that we work with in security, trade, friends, allies. Our prime ministers have excellent relationships. It's devastating to see 400,000 cases a day, record numbers of deaths in the world. And that's where in Australia I would ask people to remember that we are going through something that is different at the moment. We are safe and we've been protected, but people are dying at the rates of thousands and thousands and thousands a day in India. So we have to be very cognizant of that. And that's why we've immediately moved to send millions of masks, PPE, thousands of ventilators, oxygen, anything we can do to help, because it's a crisis and a genuine crisis. Now, we had to make a tough decision to close the borders for a few weeks here while we get logistics in order. And to your question, and to the person that's saying that, it has nothing to do with race whatsoever, because every time we've taken advice from our health officials, we've taken advice about China in the beginning of this, banning China, and obviously we were one of the first countries to do that. And as strains have developed and mutated, things have changed. We've had to change our settings all through the course of this pandemic. What has changed, and what the advice that changed, was that India was the first country to be rated high risk by our officials. It wasn't a government decision, it was a health decision. And it's a terrible thing to have to do. But the consequence of that means we've got to reset our charter and repatriation flight logistics. We've got to make sure we've got the quarantine system that can handle it. And it is a new strain of the virus.
But Minister, the headline news are pretty damaging. Think of it from the Indian viewpoint. Indian migrants, corporates, and even the Indian government. Australia is not a bad place now, but with the recent headlines of jail time for those returning from India, should this have been announced and handled in a better manner?
Well, yes, I do want to address that. It's a good question. So we actually changed the penalties in the Biosecurity Act in March last year. So these penalties are available to government for the whole year. They apply to anyone that breaches the Biosecurity Act. They're not particular to any country or any race or anything. Australia doesn't make any law on the basis of race, as everybody knows. So those penalties are the maximum penalty. The Prime Minister today stated very clearly that he wouldn't anticipate they would apply to anybody unless it was the most egregious offence. If someone deliberately circumvented all of our systems and came here and spread COVID, of course, people would expect us to penalise and deal with somebody who did that. What it is a deterrent. It's a deterrent that's been there for over a year. Certainly when we made our announcement about the travel ban and that their penalties did apply, the media and other elements did say that this was something new. Actually, this has been available to the government since March last year, and the Act was amended, and it applies to anyone that breaches the Biosecurity Act.
But again, Minister, the two accusations which have been made is racism and the government being complacent. But if the government is imposing this travel ban against Australian citizens in India, but there is no such bans against white countries such as the US, UK, when the virus was out of control over there. So why now against India?
Well, first, I reject the characterization of that. I mean, it has nothing to do with race. There are plenty of different races in the US and the UK. We don't even think in these terms. We received health advice about India. This is a new and virulent strain. There are multiple strains in the pandemic. This is dangerous. We all know it is out of control in India. It is a very serious situation. We know the Indian health system is under immense strain and perhaps not coping in many areas. There are different health systems in the UK. There are different health systems again in the US. But the UK was going through a very difficult time as well, where its health system was under immense strain. And there was a UK variant, and our health officials had to rate and deal with that at the time. This has gone through multiple considerations in different phases of this pandemic. What had to happen with the situation in India was our quarantine went from 10% positive cases from India, people returned from India, to about 60%. Now, what that meant was the quarantine, the increase in the cases and the caseload on our quarantine started to put a medical pressure on the numbers. So we had to take a pause. We have to reset the logistics because the medical advice says you'll need 2 different negative tests to get on a plane. Because as you know, Pawan, and everyone knows watching, nobody wants to get on a plane and infect everybody on the plane, and nobody on the plane wants to come here and infect everybody here. These things have to be worked through airports, through different countries, and the situation has changed. And it's so serious in India. We have to take it seriously. The government's doing that to protect Australians, but we are also hoping to be up and running again to repatriate people, restart those repatriation charter flights into Howard Springs as soon as we possibly can.
So you said that there will be a review, as the Prime Minister has said, on the 15th of May. All indications are that the number of infections in India are not going to decrease. And in fact, the number of deaths could be increasing even at that time. What can we expect from these, from the review on the 15th of May?
Well, the Prime Minister has also said we're reviewing the decisions in the lead up to the 15th of May as well. And why we're saying
could we
that
expect something earlier than that?
Well, we expect that we can get more logistics in place, and this is what I'm getting at. You have to be able to test with new tests, some negative tests, 2 of them, to get on a plane. We have to be able to make sure those planes are safe for people. We have to make sure at this end we have our quarantine ready, and we announced 1,000 new places at Howard Springs. It will be expanded so it can take whole charter flights from India. We need to have the medical support there to do that when we're repatriating people. So all of these arrangements are being worked through right now. That's why a temporary ban was needed. And it was temporary. It was announced as temporary. And we're hopeful by the 15th, all those arrangements will be ready. But of course, you know the challenges. And in India at the moment, even getting someone safely from a village, from a town to an airport safely is also challenging. So we have to make sure that we have logistics at all ends considered and worked through. So that's why it's taking time. That's why it has to be properly managed. And when India is going through this terrible tragedy that they're going through with so many deaths and so much disruption, we have to be sensitive to not put any pressure on the Indian system as well. Lots of people in Australia have had good ideas of how to help or what we could do, but we have to work with India to make sure everything we are doing supports them in the middle of a very bad crisis, as well as helps our own citizens to repatriate those that want to leave.
Right. Minister, thank you for that. Now, just on another note, there's been a reported rise of right-wing extremism in Australian society. In this regard, there seems to be some talk of banning the swastika as an offensive symbol. This concerns the Hindu community as it's really a deeply spiritual symbol for us, which was misappropriated by the Nazis. What do you know of this?
Yeah, thanks, Pawan. This is another important issue. We'll take advice from our security agencies about banning symbols like a swastika. Obviously, the swastika is a different symbol to the Hindu symbols, the ancient symbols that have been used in their faith practices for, many thousands of years. So we're very sensitive to that issue as well. The swastika, though, can be a rallying point for right-wing extremism, and therefore, if we receive advice to remove those rallying points, we would be in favour of that. But that would not affect faith symbols. I've seen them, in all the Hindu temples and devices, people's houses. I visit. The misappropriation of that ancient symbol by the Nazis is a tragedy. But I think we're intelligent enough as a society to understand the difference and to make sure we don't impact genuine symbols of faith that are religions of peaceful and highly supported faiths in Australia.
So the Hindu symbol will be preserved.
I believe so, and certainly from the federal government's perspective, I'll make sure that we take that approach. The swastika is the meaning of the ban is to ban a rallying point for Nazism, not to target other people's faiths. And I think, we are an intelligent country and we can identify the difference between those two symbols.
Now, Minister, the budget is to be announced next week. What can the multicultural communities expect from the budget this year, especially in these difficult times?
Well, the government said from the beginning of the year, social cohesion is our top priority. It's been a good year for Australia in terms of coming together and supporting each other. And again, I thank our Hindu communities, our Sikh communities. They've helped in the fires, the floods, and the pandemic in helping other people here in Australia. Been wonderful communities. So we, of course, will be supporting social cohesion through the budget process, and that will be something that will make sure we leverage how everybody's come together and has a good view of all the communities and how we can sort of work together on shared values. And so that will be the subject of more announcements as we go through the budget process.
Anything for the aged care, especially within the Indian community?
Yeah, the Prime Minister said there will be a massive investment in aged care out of this budget as a result of the Royal Commission's findings. The government will hand down our response to all of the Royal Commission findings by the end of May, but the budget will contain a massive investment into the aged care sector.
Minister, before I let you go, just any message about the headline news which is going out these days to the Indian Australian community?
Yeah, I just want to say to people, thank you. I'm hearing from a lot of the Indian community that they support our decision, they understand it, and they're going to help us work through how we can get repatriation flights up and running as quickly as possible. And if people can work with DFAT, work with us here in Australia to identify vulnerable people in India, not everybody is on the 9,000. We need to understand who's there, who needs to get out, and how quickly they need to get out.
Sorry, I need to dial back. Sorry, Minister, for interrupting, but so you want the Indian Australian community to get in touch with DFAT in case they're aware of vulnerable people in India?
Yeah. While we go through the next few weeks, please contact DFAT. Please contact us here in Australia to work through how we can get people safely out, who wants to get out, and what their vulnerabilities might be, because you can't assume government here knows everybody who is over there and where they are and what their needs are. And in India at the moment, in the crisis, it'll be very hard to get governmental attention while people are, literally dying in the streets. So we need to work together here in Australia while we're safe here to get that list as accurate as it can be, and we're ready to go to repatriate people as fast as possible.
And to just sum it up, you're recalibrating the current situation. There are more facilities being made available at Howard Springs, and possibly there would be announcements made before 15th of May to bring Australians home from India.
We're very hopeful that we can resume repatriation as soon as possible.
That's great news. Minister Hawke, thank you for joining us.
Thanks, Pawan. Take care.